Welcome to today's presentation on Updox for Practice Fusion. My name is Katie Lashy and I'll be taking you through the presentation today. You might have noticed that the phone lines have been muted as we're recording the event, and we will go ahead and distribute that recording as well as the slides to all registrants after the event. We'll take questions at the end, so if you do have a question, feel free to open up that GoToWebinar panel and type in submit there, and we'll get through as many as we can at the end of the presentation. So I'll go ahead and jump right in. A little bit of background on Updox. We were started about 8 years ago based on a doctor. His name was Andy Barbash. He's still a practicing physician. Oh, my mouse is frozen. All right, sorry about that. I don't know what's going on there. So we were started about 8 years ago based on the idea of a physician named Andy Barbash. He was frustrated by the lack of communication tools available to people in the medical field. So if you think about your spouses or your friends and what they do on a day-to-day basis, their workflows dramatically changed and became more efficient in the 90s when everyone moved to email. Unfortunately, in the medical field, because of HIPAA, you didn't have that advantage for quick and easy communication. So what Updox was built to do is make those conversations easier for you. For Practice Fusion specifically, we offer integrated electronic fax and document management, since that is a way that you're able to exchange patient health information. And then we also help you with direct secure email as it pertains to Meaningful Use Stage 2. Our integration on the fax front went live in October of 2015, but we've actually been helping Practice Fusion customers in a non-integrated capacity for several years before that. So we've had the advantage of getting to know your workflows and your concerns and your focus when it comes to running your practice, which has really helped us get Practice Fusion customers off their ground in a hurry. So thinking about your world and kind of the steps that you go through, most Practice Fusion customers we find are either using paper faxing still, so you have a fax machine in the corner office and it's running pretty much all day long. Each time a fax comes in, you might find yourself sifting through a pile of paper, distributing that fax to collect signatures or notes, walking back to the fax machine to push it back through, waiting for that transmission report, sending it again if it doesn't come through properly, and then scanning it into the computer, logging into your Practice Fusion, finding the patient, going to patient documents, and selecting upload. And in those simple 9 steps, you're able to bring a fax from another practice or referral or pharmacy and scan it into the computer. Now, some Practice Fusion customers, since we weren't integrated until 2015, have gone ahead and adopted a fax server that is non-integrated. So the workflow there would usually include opening an application on your desktop. You can view the faxes there. Oftentimes with a fax server, you're unfortunately not able to break apart faxes page by page to omit a cover sheet or split it by patient. So you still end up printing it out for that purpose. Or if you need a signature or to jot a note down on it, most fax servers don't come with an editing feature, and certainly not a signature. So again, you still end up bringing that to paper and following the paper steps. Once you are ready to bring something to the chart, if it doesn't need to be split up or signed, you're probably saving it to your desktop, questionably secure unless you're encrypting that data at rest, and then from there hopping into Practice Fusion, finding your patient, going to patient documents, and uploading it. So while you've cut out a couple steps with a fax server, you still have a significant amount of work that you're doing each time a fax comes into your practice. So what Updox looked to do when we went live with integration is really simplify that process. And a big reason that we did that is because what we heard from practices is that when you do send something, oftentimes, even if it goes through successfully and you see that successful transmission report, you're contacted a day or 2 days later and asked to resend the fax, which means doing all of the work over again. So not only is it kind of cumbersome to go through those 7 or 9 steps for a paper or fax server process, but you also have to repeat those steps when it comes to resending the fax, which happens more often than you'd like. So with Updox, we really simplify that workflow. It's just 3 quick steps. We're a web-based application, so you can access us anywhere with an internet connection. You go ahead and log in with the exact same credentials that you use to log into Practice Fusion. So thankfully, you won't have to remember another username and password. From there, you can review the fax electronically. You can pick and choose which pages you need. You can edit or sign if you need to, and then you can go ahead and send it. We do use one sending screen, both for sending to the chart and sending out as a fax, so that if you wanted to, you can actually accomplish both at the same time. And we have redundant audit trails inside of Updox as well that we'll get into. But if you end up faxing and filing at the same time, the audit trail actually follows it to the chart too. So not only does it save you steps, but it also gives you a more robust audit trail in case you were to look back for something later. So it sounds great. Sounds like we could really make your practice workflow quicker, but we do understand that when it comes to making decisions for a practice, you worry about two main things when adopting potentially a new technology partner. Sometimes new technology can take too much time. You're consumed with ICD-10, you're trying to stay up to date with the meaningful use changes. Your practice is conditioned to be patient-centric and care-driven, not necessarily tech-savvy or passionate about systems. We also hear that budgets can be tight and you can't afford an additional cost and that you fax a lot. So with what we've done with Updox is designed our solution to be so user-friendly that it's as easy as email, so that the learning curve really is short and you see the benefit right away without seeing the drag of learning a new system. And from a budget perspective, what we always like to do is talk about the numbers that you're currently putting forth to maintain your current fax process, because in the end, not only are we saving you time, but we're usually able to save you some money as well. So taking a look at the application itself, what we're seeing here is the web-based inbox, or the universal inbox. Again, this is going to be accessible anywhere with an internet connection, even from your phone. And basically, it's designed to look like email so that it's intuitive by nature. You're going to see your newer messages on top, your older messages down below. For each of the faxes coming through, you'll see a thumbnail preview that you can mouse over and zoom in. And by the way, we are able to bring your existing fax number into Updox as well. So making the decision to go with Updox wouldn't mean leaving your number behind. From here, you can pick and choose which pages you want to send, and then go ahead and send that right to the chart or out as a fax. So taking a look at that sending screen I had mentioned, you'll see how you're able to route both ways. Let's say, for instance, though, that you weren't ready to send this to the chart because this is a lab that requires your signature, or you'd like to draw a big circle around something urgent. We do have the ability to click on one of these thumbnails at any point to access our full service editor. And what we try to do here is think through the tools that you might need when marking up a document on paper. So you do a lot of forms, so we needed checkboxes and the ability to do text notes and numerical values. You needed a free-handed drawing tool. You need the ability to erase or redact, to highlight important information. And really the aha moment for physicians, you need the ability to apply your signature. So we have one-click signatures and time and date stamps available for you too. Again, accessible anywhere on the go, which has been really, really helpful, especially for practices where the doctor splits time between locations and might need a signature while they're not necessarily in the office. When we're ready to send it to the patient's chart, through our development with Practice Fusion, they were very insistent that our sending screen mimicked the fields that you use in the upload screen to make it as easy for you as possible. So what you'll see here is that we have the same description or subject line. We have your document types pulling directly from Practice Fusion. You have the ability to assign a task to a provider when you're sending it, or if you are the provider, you can actually sign off on it as you're filing it to the chart. So again, no learning curve here because these are all the same fields you're used to when uploading a document. It's just easier to get to them. Additionally, if you needed to fax out at the same time, we have the ability to add a fax number or the name of a contact on this screen so that you can fax and file simultaneously. And oh, by the way, one more arrow down there if you didn't notice, we have those thumbnail previews from the inbox. And the reason that we bring them into the sending screen is because if you're filing things to the chart over and over again all day, or you need to fax something back out, if you forget to grab the number that you're faxing to, it would be very frustrating to have to back out from this point to go and retrieve that. So having those thumbnails down there, you're able to mouse over the thumbnail preview to kind of remind yourself of whatever you might need on the pages that you're dealing with at that moment in time. So the search for additional contacts or users field is what allows you to complete 2 actions at once. So if I were filing this to the chart and it also needed to go out as a fax, I could just type in a number. It pulls open a faxing screen the same as you'd seen for filing to the chart. It basically asks you where you want it to go and how you want to label it. So you can put a subject line on that cover sheet if you type the same message over and over again. You can create templates that kind of pull in common messages. We do offer customizable cover sheets on like a large scale too. So if you just had one for your practice, that's fine. You can just pull it from there. Or if you had different ones by different locations or departments, you have the ability to have more than one cover sheet that way as well. And then from here, it's as easy as hitting send. We do, of course, keep that search for patient contact or user field open on the right side just in case you do need to fax it to 2 places. You could actually fax it 2 places at the same time with different cover sheets with different notes. So again, just a lot of ways to save time and steps from this sending screen. Another way that we differentiate ourselves as far as outbound faxing goes is how redundant our audit trails are and how easy to use. So rather than sitting at the fax machine and waiting for a transmission report or having to dig through the system to see if something went through, we actually proactively notify practices if a fax fails for any reason. You'll get a fax failed notification at the top of your inbox that'll tell you why it failed, when it failed, and it'll include the original pages that you had faxed, so it's easy for you to grab and send again. If that, let's say they're using a paper fax still and they're throwing up busy signals, by the way, Updox would eliminate that for you. We would try the 5 times for industry standard and then let you know that it didn't go through. Or if their fax machine was offline, which happens from time to time, we would let you know about that too. But again, we're just proactively notifying you. Now, for the instance that we had spoken about earlier, where you send something and then 3 days later they ask you to send it again, you can hop into the sent box located just below the inbox. Again, a lot like email, it's going to show you everything that you've sent out, whether you're sending it out as a fax or sending it to the chart. You have a full audit trail of all sent materials. And this is searchable, by the way, too. So if you wanted to type in the name of the contact you sent it to or the number you sent it to, it's easy to retrieve that and resend. In addition to these audit trails and Updox, if you fax and file simultaneously, we also send a little note along with it to the patient's chart. So it'll say, when this was filed, it was also faxed to such and such number with these notes. So just really, really easy for you to keep an eye on that after the fact. So that's kind of a bird's eye view of our faxing solution and some of the points that really make it a good fit for practices and some of the value they've been able to pull so far. We do have another solution that Practice Fusion practices have gotten pretty excited about over the last couple months, and that's called our Blast On-Demand messaging tool. So we were hearing that practices wanted the ability to send a text message or a phone call to a group of patients or a group of contacts, but what it was doing is taking their team off of the phone to get that message out. So some of the reasons that we'd heard this being used would be office closures. It's certainly the time of year for that. Unexpected sicknesses that have the doctor rescheduling appointments. You can also use it to get no-shows back on the calendar or remind patients of upcoming appointments if you wanted to load the list in that way. We also have the ability to drive attendance to flu clinics or immunizations that you might get a revenue boost from. Let patients know if they're due for annual screenings, send out a warm birthday message, reach out to patients who have had appointments in the last week to thank them for their business. So a lot of different reasons from kind of a warm and fuzzy perspective. It's not just for patients though. We also have practices that are using this as a way to nurture their referral sources. So if you wanted to send a monthly message to all of the doctors that refer physicians to you or that you refer to, maybe to thank them for their business, stay front of mind, you have the ability to use it that way as well. Beyond that, there's also the CMS requirements to send educational content, and Blast would be a great tool to do that. Or just a simple, we're opening a new office, or they're doing road work and this is where you'd park. Those are all really good use cases as well for this tool. What it basically is the ability to send a text, a call, or an email on demand. Really easy, just a couple quick steps. We try to keep things as simple as possible. And what it lets you do is target your message to specific groups of patients or contacts at once. And saves you the time of putting someone on the phone or doing postcards or snail mail or any of that. To send a blast notification, you would choose your medium between email, telephone, and text if you're a Practice Fusion customer. You can go ahead and grab a patient list right out of Practice Fusion by going to Reports and Patient Lists. Upload that to the system, and then you're ready to send your message. So you would select your list, either type in a message on the fly, or you could even create a template if you're going to send something over and over again, and then go ahead and send it out. The templates, by the way, similar to our faxing templates, if you were going to send a thank you to patients once a week or birthday messages or something like that, you could type the message one time and we actually pull in the personalization tokens like your first name, the practice name, phone number, to save you the step of typing in that message. When it comes to actually sending the message, sometimes practices want to hear what it's going to sound like or see what the text is going to look like before they put it in front of their patients. We do have these template previews available as you're kind of customizing it so that you could call yourself and listen to the message before you put it in front of your patients. Just in case they ask you about it, you might feel more comfortable hearing it firsthand. The same is true for text messages. You could look at that before you send it as well. And you can also drill down to do custom lists. So let's say you pull in your patient contact list and you only want a handful of patients that have a certain diagnosis because you're sending an educational message. You can go ahead and type in the names of those patients and just pick them from the list. If you have a patient or a contact that you know is going to be crabby if you send them a message, you can remove them from the list as well. So a great feature to tailor your list to who you want it to send to. We also offer reporting features. So if you were curious how many people were receiving your message, if you wondered why certain people who are not receiving your message, are they missing a mobile number, that sort of thing, we do give you a comprehensive report of the messages that have gone out and what the outcome was. And you can even export the failures if you wanted to use it to clean up your contact information database as well. So I did want to talk through the cost of these solutions now that we've given you an overview on the functionality and why it's a good fit for that from that perspective. We obviously save you time when you think about 2 minutes per fax on the paper process or the fax server process. I think that's pretty obvious with the workflows. But from a hard cost perspective, we also find that we're able to save practices dollars. So if you consider the toner, if you're using a paper-based system, if you're considering the cost of a case of paper, how much you're spending on a fax line on a monthly basis, for each 5,000 pages, practices can spend as much as $162, but you don't necessarily think of that way because they are all individual costs. Another benefit to Updox is that if you're concerned that you're a high volume faxing practice and we're going to get expensive, we do offer a trial period so that you can see if the time is worth it that we're saving you, and you can also estimate what your cost would be compared to what you're currently faxing. And what's really great about our account executive team, who does our follow-up pricing conversations and personalized demos, is that they have a calculator where if you tell them what you're spending on things, they can tell you exactly how much it's costing you each month compared to what you would spend with Updox. So a really great pricing conversation if you get the chance to speak to one of them. We do have a special webinar promotion that I wanted to mention before we break for questions. We have our falling promotion going on this month, so that's 15% off of the base fee for your first 6 months as a customer if you register by Monday, February 13 using promo code FALLING. So be sure to keep that in mind as you kind of get ready to move forward. We do offer all new customers a 15-day free trial because we are so confident that you can see the value in that time. We offer free training as well as free customer support, and the free customer support is actually indefinite. So being a month-to-month service like Updox is, if after the trial you're not happy, if after the trial you're kind of happy but you want to give it one more month to see if it really takes flight, we are month to month after that. So we're on the hook to keep you happy and keep you using that solution. And if it isn't working out, you're not tied to us in any way. All right, so I'm going to go ahead and hop into my question section here. I have on my screen, though, just in case you wanted to jot this down, we do have a direct line to our sales team if you wanted to get a pricing quote or a follow-up demonstration scheduled. You're also welcome to email sales@updox.com, or our Practice Fusion page has a form on it where you can request a demo that way too. So however you want to learn more, we're happy to help you. Those are just some easy ways to get a hold of us. have a question about if you're able to ask questions because we're muted. Unfortunately, we don't have the ability to ask questions verbally, but if you wanted to type in submit questions, I'm happy to answer them for you here. Or if you wanted to do more of like a one-on-one demonstration, our account executives would be able to do that for you, which is kind of neat too, because they do that right inside of the application, so you can actually see what the clicks do and what the expected behavior is and how quick it is to do things. So it's really a good exercise to go through that with them, and they can take you through it in about 15 minutes, so we're not taking a ton of your time. I have a question. Do I need to keep 2 separate phone lines in order to use Updox and keep a regular fax? The answer is, so what happens, we provide a number during registration that some practices will use outright, but most practices have an established fax line. So what we do is either call forward that number to Updox, or we can port the number away from the phone provider. With a call forward, you can, if you have a credit card machine tied to that fax line that you're using, you can call forward on the inbound, and then your credit card actually operates outbound, so you can keep those together. You do still pay the phone company for the fax line that you're using from them. What's nice about a ported number is that you no longer pay the phone company for it. So if we port your number over, it's kind of like if you were going from Verizon to AT&T and you wanted to bring your number with you, AT&T ports the number away, and then you no longer pay Verizon for that number. We can do the same kind of thing for you in terms of fax numbers. Now, if you had 2 fax lines because you have 2 fax numbers and you have different things that you want to go to different places, we can actually route that to different queues inside of Updox. And queues are going to operate almost like miniature accounts inside of a main account. So if you had a Dublin, Ohio office and a Hilliard, Ohio office, because we're located in Columbus, you could have a Dublin work queue with certain users and route one number there, and then a Hilliard work queue with certain number and route or certain users and route a number there. So we do have the ability to accommodate multiple fax line situations that way. Or we could point them both to the same inbox, and that works too. I have a question about costs. So our list pricing is currently $60 per provider per month, and there are 500 fax pages included per provider. That being said, our account executives would be better suited to provide an exact cost based on your workflow, but that is what we have as our list price. And then I have a question, how do I send paper faxes if I want to send paper and not keep my old fax line? So if you forward your number, you still have the ability to fax out from your paper fax machine in addition to being able to electronically fax out from Updox. If you port your number, you won't have that ability, and what practices do is just scan those documents into the computer and send out from there. But I do think what they find is they end up having a lot less paper to fax out by moving to Updox. So they're scanning less than they think they're going to for that outbound perspective. If you think about, and one thing I didn't mention, the inbox can also be used to drag and drop files in. So if you have a form that you send out a lot, you can drag that into the inbox, fill it out electronically, and fax it out. So that seems to be one of the things that gets paper faxed the most is a form. By making that digital as well, Updox helps you get rid of that paper piece too. So you just scan it in and fax out if you needed to, but you'll find yourself doing that less now that you're moving off of paper. A question about workflow. Does the workflow include the provider going into Updox and seeing their faxes and nobody else's, or does a staff member send the fax to Practice Fusion for the practitioner as a task? So the answer is it's either way you want it. So we have some practices, if you need a pen-based signature, you're going to need to use Updox because you have to do the one-click signature. For a sign-off, and quote, the way that most EMRs and Practice Fusion do that, you can either sign off on it while filing, or you can just assign a task to the provider once it gets to Practice Fusion, and they can sign off on it from there. So we have some doctors who are super involved in the front end management of faxes. They apply a signature, they file it as a signed off document. We have other practices where if they don't end up signing a lot of documents anyways, they don't even go into Updox. They just view the things that people are uploading into Practice Fusion and sign off on them there. So it depends what you want your workflow to look like. If you were finding yourself signing things, we do have tags that operate almost like folders. where your staff could tag things to you that need your signature, and you could choose to only see things that are tagged to you. So in that way, Updox could operate as a personal inbox where you can sign off on things. So it just depends. There's a ton we can do with workflow and organization, depending how complicated your workflows are for the practice. We're usually able to mimic it in a way that still saves you time over your paper process. A question about use with MIPS and MACRA. So I don't know that faxing is necessarily tied to those. I know that the direct secure email was tied to meaningful use, which is tied to improving outcomes, which is kind of along the MIPS and MACRA lines, but I don't think the faxing necessarily ties to that. To avoid penalties for direct messaging. So that would probably fall under our direct secure email section, where we also provide direct secure email to Practice Fusion users. They'd actually need to get you started with that because it's an indirect relationship. We're kind of the man behind the curtain for that, but we are their direct secure email partner to help you avoid those penalties. How long does it take to actually start getting faxes into Updox? If you were to sign up today, you can usually call forward a number within an hour, contacting your phone company. If you use our number that we provide to you, the same moment that you register for an account, you have a fax number that you can use to send and receive messages. So getting signed up and started, we actually have self-led materials that have a recorded training. We have practices same day for Practice Fusion all the time. How does Updox know if a fax is medical and goes into Practice Fusion or the lunch menu from the deli? I love the way you asked that. So as far as Updox goes, the inbox is where you would review the fax and determine if it makes it to the chart. We do have, when we're asked, can you auto file things into the chart, or can you bring it into the chart without someone looking at it? I think that's actually to the disadvantage of the practice. While it might save you time on the front end, it's going to clutter the chart with documents that are not medical in nature. Reviewing them inside of Updox, you actually determine which chart it's going to and which section of the chart, and we make that process really, really easy, but we certainly don't take the part of filing out of the equation. So you still have control over what makes it into the clinical chart. I have a question about charge for emailing in Updox. I'm not sure. I don't believe there is, but I'm not certain. The direct secure messaging, you'd have to ask Practice Fusion directly about that because they actually provide those to you, and I'm not sure if there's a fee structure associated with it. I don't believe so. But from a faxing perspective, if you wanted to move forward with that piece or the blast on-demand messaging piece, we would be able to price that and sell that to you directly. But a question about the free trial period, it is a 15-day free trial, and that is days, not work days. So 1/2 of a month, essentially. I have a question about Practice Fusion having a place to store prescription refills that were faxed. I am actually not sure about that. That would be a better question for them. I don't want to guess and be wrong, so I'm not certain what document storage sections they have specifically. And I think that's all I have for questions. You guys put me through the ringer there. I love it. Please let me know. Feel free to reach out directly to our sales team, respond to the thank you email with the slides and the recording. We're happy to get any other questions answered, and we're happy to get you started. Thank you so much for your time this afternoon. I hope you have a great day.